Hello, I'm Urologist Erdem Akkaya. Our topic is the connection between insulin resistance, erectile dysfunction, and testosterone. What is insulin resistance? Insulin resistance is the difficulty in taking blood sugar into cells, and wanting more insulin since the body can only take the blood sugar into cells when there is more insulin. So, this is a resistance. The name of the disease comes from here. It is not diabetes. Sugar may be too high in the patient with insulin resistance. As insulin resistance increases, diabetes occurs in the patient. How does insulin resistance occur? Insulin resistance occurs mostly due to the patient's choices. Of course, the genetic structure also contributes. When we say choice, what we mean is this: imagine that you are going to a shopping mall. There are two kinds of restaurants, one of them serving stews, and the other giving hamburgers. If you decide to have a meal at a hamburger place, for example, if you go to their websites, it says their calories there. The Whopper hamburger is 650 calories, medium potato chips are 350, a medium Coke is 180. And if you eat hot sauce, 40 more calories, which is about 1,220 calories in total. If you say, I won't drink Coke, but I'll drink a milkshake, then you get 380 calories, about 1,400 to 1,450 calories in total. On top of that, you should definitely eat a dessert. When you eat that too, you will get out of there with about 1,600 to 2,000 calories. Of course, this is where the glycemic index comes into play. These foods have a high glycemic index which gets into the blood very quickly, so they increase insulin the moment they enter the blood. In addition, we should consider that you are eating mildew-proof bread, non-perishable meat, preservatives, and additives. Of course, these also affect the metabolism in some way. The patient makes this choice. On the other hand, another person wants to eat okra at the place where the stew is cooked. One serving of 100 grams of okra has 33 calories. If it is cooked with olive oil, it has 200 calories. If you eat a kapuska meal, it has 200 calories, and if you eat with olive oil, it's 250 calories. In that place, even if you eat until you are totally full, you can't get more than 500 to 600 calories, but when you don't eat meat. Insulin resistance develops slowly in this way. You will say there's no Whopper in the village, but there is white bread there. In fact, people consume white bread a lot, white bakery products a lot, pastries and donuts a lot. So, insulin resistance develops. I can say that white bread is no different from chocolate and Nutella, so it has a very high value in terms of glycemic index, blood sugar. It feeds you so quickly, of course. This high blood sugar causes insulin resistance over time, and insulin resistance causes tissue damage in the body. Of course, all tissues will be damaged, but will it not damage the genitals? Will it not decrease testosterone levels? Will it not cause problems in the patient's sexual life? It will definitely. The patient's sexual well-being will decrease, and the testosterone level will decrease. What should be done to prevent insulin resistance in patients? To avoid insulin resistance, the patient must use his will, make his choices correctly, not enjoy high blood glucose, and discipline his will. The patient needs to do sports, and do resistance exercises. We can say that it is a disease of our age. Actually, to make a very simple analogy, you never put gasoline in your diesel vehicle. Why? Because it breaks down. Your genetic structure does not bear with foods with a high glycemic index and high calories. In some patients, the body can bear with them, but in most people, 90% of people, it does not. So you will not use them. You shouldn't get them in your body. As I said, diet selection is very important. Some obese patients also come to my clinic. When I ask the patient about his diet, the patient says, I don't eat anything, doctor. The patient is overweight, he says he doesn't eat anything. Well, I ask what he ate yesterday, again he says he didn't eat anything. Okay, the patient actually eats bread. Unfortunately, bread is also consumed a lot in our country, especially white bread is something that is consumed a lot. This was one point of it, but there is also another point. Does insulin resistance develop with a decrease in testosterone level with advancing age? There is also such a situation. Why? Because when testosterone is given to patients with insulin resistance gets better. So, although not in big groups, there are also such studies. These studies were made thinking, let's try doing sports and diets for patients with insulin resistance, and if this doesn't work, let's give them testosterone. And in those studies, it was observed that the insulin resistance was recovered by testosterone, and there was a serious increase in both the sexual life and the quality of life of the patient. In fact, it's a wonder if they both damage each other or if they trigger each other. So, can testosterone treatment be applied to patients with insulin resistance or obesity? If so, what should be taken care of? Testosterone replacement therapy is used in obese or overweight patients. The thing to pay attention to while practicing it is to evaluate the patient well in terms of cardiovascular. Generally, these patients can have high blood pressure and high cholesterol, and the testosterone we give can also increase cholesterol. It is necessary to evaluate the patient well in this respect. In terms of cardiovascular, it is necessary to pay attention to the blood pressure of the patient. While giving testosterone, it is generally necessary to prefer topical ones, because the injected ones have a little more aromatization to estrogen, topical ones slightly tend more to turn to dihydrotestosterone. That's why topical ones are preferred. So, what are the treatments for insulin resistance? There are many treatments for insulin resistance, mostly metformin is used. Herbal berberine is used in patients, in addition to diet and sports. Many natural and chemical drugs can be used. Saxena is used for example, which is lipodystrophic. Now, peptide treatments for obese patients are becoming very popular abroad. We can say that growth hormone analogs, growth hormone-releasing peptide analogs have become very popular among patients. Patients get a very fast response from these. Some of these are approved by the FDA, some are not, but they are not illegal. Especially in the USA, these products are sold in pharmacies that prepare magistrate medicines, which they call compass pharmacies. It can also be seen on the internet, and can be prescribed as an e-prescription. I see in Turkey is sold on some internet sites. Publications are also very limited. But the stories of these peptides come from the hormone that produces growth hormone. I think these growth hormone analog peptides will become more popular in the following years. It really affects the patients dramatically and they benefit from it seriously. My opinion is that testosterone replacement therapy does not make much sense unless the patient takes his diet under control. You can't manage that. If the patient consumes 3,000 to 4,000 calories per day and does not burn it, do as much replacement therapy as you want, the patient will not get better. The most obvious and rapid improvements are seen in bariatric surgeries. There is an obvious increase in testosterone level in patients undergoing bariatric surgery and an obvious increase in the patient's quality of life and well-being. In conclusion, we must answer this. Is it possible to practice testosterone replacement therapy in patients with insulin resistance or obese patients? When the patient is evaluated well, testosterone replacement therapy can be given to the patient by paying attention to the blood pressure and cholesterol profile, of course, under the control of a doctor. Thank you for listening, best regards.